Let's see how sharp your OT brain is today. Answer these bite-sized questions about teaching and learning process and keep your skills fresh. In an outpatient pediatric setting, the OTR provides verbal cues to the child to help correct her hand and arm position while holding the spoon and bringing it to her mouth. This is an example of C. Extrinsic feedback. Context. Extrinsic feedback is information that supplements intrinsic feedback, such as visual, verbal, and tactile cueing. In an outpatient pediatric setting, the child is working on correcting her hand and arm position while holding the spoon and bringing it to her mouth. The child realizes that placing his shoulder in abduction and internal rotation helps his retrieve food more efficiently with the spoon. This is an example of A. Knowledge of results. Context. Knowledge of results is external feedback received after completing a task, where the outcome of the movement serves as the feedback. The OTR works with a client to repeatedly practice sit-to-stand and stand-to-sit transfers from the toilet and the sofa during one intensive session while following hip precautions. This is an example of B. Massed practice. Context. Massed practice means the patient spends more time practicing than resting during the intervention session. The OTR is working with a client in the recovery phase of Guillain-Barré syndrome on lower body dressing techniques. The session includes 1-2 minutes of practice, followed by 6 to 7 minutes of diaphragmatic breathing to improve core strength, reduce frustration, and increase activity tolerance. This is an example of A. Distributed practice. Context. Distributed practice means the patient spends more time resting than practicing during the intervention session. Hopefully you learned something new or proved you still got it. Follow Moza Study Bites for more.